Hello, and welcome. Today we're diving deep into a serious complication of diabetic nephropathy. This progressive kidney disease can silently damage your kidneys over time, eventually leading to kidney failure. Understanding the disease, its causes, and management is crucial for anyone living with diabetes. So, what exactly causes diabetic nephropathy? The primary culprit is prolonged high blood sugar levels, often associated with poorly managed diabetes. Over time, this hyperglycemia damages the tiny blood vessels in your kidneys, specifically the glomeruli, which filter waste from your blood. High blood pressure or hypertension can exacerbate this damage, accelerating the progression of the disease. Genetic factors and race also play a role, with some individuals being more predisposed to developing diabetic nephropathy than others. Let's delve into the pathophysiology. High blood sugar causes the glomeruli to work harder, filtering more blood than they're designed to. This overwork leads to glomerular hypertrophy, meaning the glomeruli enlarge. The glomerular basement membrane, which supports the glomeruli, also thickens. Eventually, these changes lead to scarring known as glomerulosclerosis. As more and more glomeruli become damaged and scarred, their filtering capacity decreases. Protein, specifically albumin, begins to leak into the urine, a condition called proteinuria. Over time, the kidneys lose their ability to filter waste effectively, leading to a buildup of toxins in the blood and ultimately, kidney failure. Diabetic nephropathy is a significant health concern, particularly in developed countries. Its prevalence is closely linked to the rising rates of diabetes worldwide. Statistics show that a substantial percentage of individuals with diabetes, both type 1 and type 2, will develop some degree of nephropathy during their lifetime. Certain populations, including African Americans, Hispanics, and Native Americans, have a higher risk of developing the disease. Understanding the epidemiology helps us target preventive measures and allocate resources effectively. In the early stages, diabetic nephropathy often presents with no noticeable symptoms. This is why regular screening is so important. As the disease progresses, symptoms may begin to appear. These can include swelling in the ankles and feet, called edema, due to fluid retention. You might notice more frequent urination, especially at night. Fatigue, loss of appetite, nausea, and persistent itching can also occur. As kidney function declines further, symptoms of kidney failure such as shortness of breath, confusion, and chest pain may develop. Diagnosis of diabetic nephropathy typically involves several tests. A urine test to check for protein, particularly albumin, is a key indicator. Blood tests, specifically measuring serum creatinine and estimated glomerular filtration rate, or eGFR, assess kidney function. An elevated creatinine level and a decreased eGFR suggest impaired kidney function. Kidney biopsy, while less common, may be performed to confirm the diagnosis and assess the extent of kidney damage, especially when the cause is uncertain. Diabetic nephropathy is often classified based on the level of albuminuria and GFR decline. Of Stage 1 involves elevated GFR, a glomerular filtration rate with kidney enlargement. Stage 2 features slight albuminuria with normal or increased GFR. Stage 3 is characterized by moderate albuminuria and decreased GFR. Stage 4 presents with severe albuminuria and further decline in GFR. And Stage 5, also known as end-stage renal disease (ESRD), involves kidney failure requiring dialysis or transplant. The treatment and management of diabetic nephropathy focus on slowing its progression and managing its symptoms. Tight blood sugar control through diet, exercise, and medication, including insulin or oral hypoglycemic agents, is paramount. Blood pressure control, often with ACE inhibitors or ARBs, is crucial to protect the kidneys. A low-protein diet may be recommended to reduce the workload on the kidneys. Medications to manage edema, anemia, and other complications are also often necessary. In advanced stages, dialysis or kidney transplantation may be required to sustain life. Prevention is always better than cure. The best way to prevent diabetic nephropathy is to prevent or effectively manage diabetes. This includes maintaining a healthy weight, eating a balanced diet, exercising regularly, and monitoring blood sugar levels closely. Regular check-ups with your doctor, including urine and blood tests to assess kidney function, are essential for early detection and intervention. If you have diabetes, work closely with your healthcare team to develop a personalized management plan. The prognosis for diabetic nephropathy varies depending on the stage of the disease at diagnosis and how well it is managed. Early detection and aggressive management can significantly slow the progression and delay or prevent kidney failure. Recent research is focusing on new medications and therapies that may further protect the kidneys. For example, SGLT2 inhibitors, initially developed for diabetes, have shown promise in slowing the progression of kidney disease. Researchers are also exploring new diagnostic tools to detect early kidney damage and personalized treatment approaches based on individual genetic profiles. While diabetic nephropathy is a serious condition, With proactive management and continued advancements in research, it's possible to live a long and healthy life with diabetes.